This year I turned 40, which means a lot of my friends are turning 40 as well. And as women, we are told at the age of 40, we should start the screening process with mammograms. As a breast cancer survivor, I have something very important and I feel compelled to share with you. So if you are at the age of getting your mammograms, please take a minute and listen to this. This one thing is single-handedly what saved my life. I'm going to give you a quick recap of my story so you can understand why this is so important to me. My grandmother died at the age of 48 of breast cancer, so breast cancer was always on my radar. But when my sister was diagnosed in her 40s, I talked with my healthcare provider and we decided it was time to start mammograms even before the age of 40. So I went and got my first mammogram, patted myself on the back, and went on my merry way. But a couple of days later, I got a phone call. No alarms, nothing to be worried about, but the radiologist wanted to share with me a very important piece of information, my type of breast tissue. There are 4 different types of breast tissue, 1 being almost all fatty, and 4 being extremely dense breast tissue. Now, a very petite person could have fatty breast tissue, so it doesn't matter what type of body you have. But I was called because I had type 4, which was extremely dense breast tissue. Why is this important? Well, because a mammogram can't see anything. It's like looking for a specific snowflake in a blizzard. So having this piece of information, I talked with my healthcare provider and we decided that maybe we should add in another type of screening. So a year later, I got my second mammogram, was told everything looked fine. 6 months later, I had my first breast MRI, and thank God I did. That is what found my tumor. My tumor was so deep and close to my chest wall that it wasn't something I could feel in my monthly self-exams. Now, if I had not had this MRI, the mammogram would have never caught it until I felt it close to the skin surface, which means instead of stage 1, it could have been stage 4. So a lot of states in the United States require that the medical professionals share this very important piece of information with the patient, but there are still some states that don't. So I ask you, if you are getting your first mammogram, please find out what type of breast tissue you have. Now, I'm not saying that if you have type 4 that you're going to have breast cancer, but unfortunately, the studies show that you are at a greater risk of getting breast cancer. Thank you for listening. To me, this is so important. If you want to learn more about dense breast tissue, please go to www.rudense.org.